Hi, my name is Dr. Divya Patel, and I'm a child, adolescent, and adult psychiatrist currently at the Center for Developmental Psychiatry. Today, I want to talk about anxiety in children, specifically some of the signs and things to look out for that don't always look like anxiety, but may be helpful in understanding what anxiety looks like in younger children. Anxiety in kids doesn't always look like worrying or stating that kids are worried about something. It might look like frustration or easily irritable with family members. It might look like really big feelings when playing with toys and something doesn't go the right way. And so, in a lot of young children, oftentimes observing their behavior and observing their interactions with other people can give parents a lot of information on how your child might be feeling. I always say I think that kids have a lot of resilience and a lot of ability to adapt. However, we do have to kind of give them the tools and information sometimes of how to do so. And so I think observing their behavior will help parents understand better what their needs might be. Some like examples I think that are helpful in young children is their interactions in school. I think school is a wonderful environment for a lot of kids, but for a lot of kids, especially kids with anxiety, it can be really stressful and it can bring about a lot of feelings that they don't necessarily have the words or the tools to express. And so parents might notice that kids are hesitant around going to school. They might be hesitant about talking about what's going on at school. It might manifest as separation anxiety, where kids are having really big feelings or tantrums around getting to school, around saying goodbye to their parents. And it might also just manifest as fights at school or behavioral issues at school that maybe don't seem in line with the child's personality, right? At home, they're very kind and very understanding and very nice. And if they're getting into these behaviors or trouble at school that doesn't seem in line with what you're seeing at home, maybe there's something going on there as well. Um, I think other sometimes younger kids will be really creative and thinking about ways to avoid school. So if you're seeing a lot of headaches, a lot of stomach aches, physical complaints oftentimes can be a manifestation of anxiety in children that sometimes we overlook or sometimes we don't connect the two. So I think that's a pretty important point that comes a lot with children, maybe not necessarily telling you that they're worried about something, but they might have a lot more physical complaints. Kids sometimes will ask to go see the doctor or go see their pediatrician because they know that they're feeling unwell, but it's not necessarily unwell, maybe in like a physical sense, but a lot of times it can be unwell mentally, and they just don't have the words to correctly express how they're feeling. And then the last thing is always like sleeping, right? I think sleep is really important for everyone, but especially for kids if they're having a lot of hard time falling asleep, staying asleep, or just generally kind of relaxing their body where they're unable to turn off their brains. That can be one of the first signs of anxiety in a lot of children. And I think that, again, it's something that you can observe and you can kind of notice and work with your children on helping them practice mindfulness and intentionality around a bedtime routine that can oftentimes help ground them and then in turn help their mood and anxiety if they're getting restful sleep. Um, the last thing I kind of wanted to touch on is like a brief overview that I think could be helpful for parents learning how to parent an anxious child, right? I think that is like a difficult thing for a lot of people because you don't want to do the wrong thing, you don't want to say the wrong thing, but you also don't want to see your kids suffering, right? You don't want to see them worry. And so I think the natural parent instinct is to, you know, provide some sort of accommodation if the child is scared of going to school. Maybe you might think, for example, separation anxiety, you might feel like, okay, they're having a hard time saying goodbye, let me like sit with them for 10 minutes and prolong the goodbye and really try to comfort the child. But a lot of the times that actually makes anxiety much worse. We oftentimes recommend really brief short goodbyes, reassurance, and like a scheduled time where you'll see them again. And again, it's just limiting some of that anticipation anxiety that worsens if you also kind of exhibit some of those accommodations. Kids pick up on parents' anxiety a lot as well. And so what happens sometimes is because you're seeing your kid suffering and worrying, you're also worrying. And that worry amplifies the child's worry. And so I think, trying your best to give reassurance in a calm, consistent, and brief manner, so you're not getting pulled into or tangled into some of that anxious, ranting or rumbling of the thoughts that the kid might be feeling. And I think also really understanding that the child is looking to you to be a calm and consistent figure. And so, even in situations that seem really stressful or are really stressful, trying your best to manage your own emotions and providing like a grounded, consistent feedback to the child can be really helpful, and modeling how you want your kiddo to kind of deal with difficult emotions. Um, so those are some of the tips and some of the things that I think can be helpful as an overview. But anytime I think that if you're having an intuition or a gut feeling that what your child is dealing with is doesn't seem consistent, or doesn't seem in line with what they should be feeling for their age, I think it's always a good idea to talk to a professional and just have some of these things evaluated early on. The goal is always to intervene early so that we can give our children the tools and the ability to deal with some of these big feelings that they're having, as well as support so that their developmental trajectory continues on in a positive way. So that would be my advice. And, we're open and always willing to talk to any parents that are worried about their kids or just want helpful guidance or advice on how to deal with certain behaviors or things that might be coming up that are disruptive to the child or disruptive to the family as a whole. Thank you.